We almost exclusively focus on childhood cancers, particularly high-risk childhood cancers, which have really poor prognosis that haven't changed for decades, and we're trying to find new therapeutics for these diseases, particularly cases that have spread to other parts of the body, which are really difficult to treat. And then what we try to do is to take those findings and apply them to adult malignancies or other diseases. So my name is Poul Sorensen. I'm a distinguished scientist at the British Columbia Cancer Research Institute and a professor of pathology at the University of British Columbia, and I hold something called the Asa and Kashmir Johal Chair in Childhood Cancer Research at UBC. When I had been a faculty member for a few years working at BC Children's Hospital, we made a really interesting discovery of a genetic change in a super rare childhood cancer called congenital fibrosarcoma. Basically figured out what was driving that tumor type. And that was a really big finding for us because it turns out that that same alteration is also present across many other human cancers. And this led to the development of a drug that targets the enzyme entity involved in this disease. So if they have this genetic alteration, then they can be treated with this drug. I was contacted some years ago after making this discovery of these NTRK fusions by a mother in Boston who wanted to tell me that her daughter, who had had a brain tumor with one of these alterations, was treated with the drug. After treatment, finished top of her class in high school and had just been admitted to Boston University. Wonderful story, and that is just so motivating, right? I think there's nothing that beats that in terms of feedback that what you're doing actually means something, for the community. The discovery of these alterations called NTRK fusions is a great example of how basic cancer research can lead to therapeutic interventions that can be applied worldwide. So what we're really excited about is the application of immunotherapy to childhood cancers, where you harness the immune system against tumor cells, either using antibodies or immune cells, and combining that with new therapeutic agents that have been discovered by studying altered pathways in cancer cells. I do have a cautionary note though. There's a lot of talk about AI, artificial intelligence, and I worry a little bit that if we focus too much on AI, we lose the skills of creativity to come up with our own ideas. I think we have to find a balance where we let AI help us, but it doesn't drive the process.